You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. Hi, everybody. I'm Dr. Kat Gallus, and you're listening to All the Bees. Hey, Bree.
Good morning.
Okay, so today we are going to spend our episode talking about Brianna and my favorite surgery of all time to do.
I want to preface, it's a great surgery, but when we first did it together, we were in a very, very small OR, and it was so uncomfortable. I deemed it my least favorite surgery to ever be in. I was like, never again. So our running joke is the thigh lift. And every time she books the thigh lift, I'm like, I'm not going to be here that day. So
You always claim you're going to call in sick.
yes, all the time.
To be fair, you're right. We did do a thigh lift in a closet that was pretending to be an OR, and it was very close quarters all the way around. But yeah, so we joke around that it's our least favorite surgery, which is not the case. We like doing it. It's in the right person, it really makes a difference and people appreciate it. But we're going to get to that later because first we have some important celebrity gossip.
More importantly,
I saw this little Daily Mail thing about Anne Hathaway. First of all, girl only 42, so whatever. Of course, she's going to look good. And
she's always looked so good, though, I feel like.
Yeah, she gets a lot of hate in general, though, for stuff. I don't know why.
I saw her at the runway show on Instagram, and she looked so good.
Yeah, that's what they're talking about. She's at the Ralph Lauren Fall 2025 runway presentation. Fun fact, I went to college with Ralph Lauren's son.
Oh, really?
Mm-hmm. David.
Oh, that's cool.
Yeah. Anyway, I mean, he was fine, so we didn't hang out in the same circles. Shocker. David. So anyway, yeah, she looks great. She's got a couple of things. If you put your hair in a really tight ponytail, it's like almost a facelift, honestly. So that always helps. Can't say enough about that.
On the other one, she's like leaning to the left. So of course your face is going to look more scrunchy.
Yeah. And she's making a face. But yeah, her hair and makeup is impeccable. She probably has done a ton of non-invasive things to keep up her skin and complexion and tightening. So I think it's all, I love that they're like, her complexion is suspiciously smoother than 6 months earlier. I'm like, it's not, it's just different lighting.
Yeah, different makeup, different lighting. And I feel like if you look at like her masseter area, like if she had a facelift, that shit would be tight.
Right.
Tight and right. You can see the little pooching.
And also I saw I feel like it was maybe Instagram, and they showed a little video of her in action and she's turning her head. And as she talks, you can see a little bit of jawline filler that doesn't move. So, probably had a little filler, but overall I like it.
Refreshing. Me too.
Looks good.
I don't think she looks so very dramatic as they say.
Right. So speaking of dramatic, the Daily Mail, People magazine also covered this, the free facelift from a social media ad. And then I almost died as hundreds of people watched. Okay. So a little extreme, but I actually remember when the announcement for this free facelift went because it came up on Chatter.
She's like, I signed up.
I almost did. I was joking about it. It came up on Chatter on one of my groups. They're like, hey, Mike Nyak's looking for somebody to go to Turkey so he can do a facelift for free in front of a bunch of people. And I was like, present. But I never signed up. I don't think I would have been as fun or as he probably would have been like, what? No, get out. You're another surgeon. Stop. The reason it came up is because as a member of ASPS, you're not supposed to give away or raffle surgery because it's considered a compromise of informed consent. Like, what if the lady didn't really need a facelift, but she's won this contest? A little sticky. Anyway, Nyack is not actually a plastic surgeon. He's an ENT facial plastic surgeon, so different organization and whatever. Anyway, so this mom from Indiana wanted a free custom facelift. She's 52. I think we were just talking about this yesterday with our MERS Radius rep, how not to drag the Midwest, but sometimes their 52 is our 62. It's like people just aren't as glam, or it's not as big of a concern. But if you scroll down, you can see that she had a lovely result, but she had essentially a $250,000 facelift. And she looks good for 52, honestly, and the before. He just, again, resurfaced her skin. Dr. Nyack is known for that like super chiseled neck. And in her, it looks amazing. Like looks really good. He did eyes, brows, fat transfer. He did it. I mean, it's a phenomenal result. I guess what happened is that during the surgery, she had a lot of bleeding. It just was, if Nyack hadn't done a million facelifts, he probably would have been more panicky, but he was fine. And he used the hemostatic net, which is basically, it looks like someone took a fishnet hose and applied it to your face, but with suture, and you leave that in for 3 to 5 days. So he doesn't normally do hemostatic net, but he did in this case because of the bleeding, probably because they're in a foreign country, blah, blah, blah. She did fine. So
Yeah, she looks great.
Yeah. I mean, you had $200,000 worth of work for free. Now invest
That's
in some
insane.
decent skincare, please.
Right?
And sunscreen.
I know, and she looks so natural.
He does do a really great result, and it looks natural. You can see her earlobe is exactly the same, so there's no telltale sign there. Yeah, she looks fantastic. Really,
Yeah.
really lovely result.
She looks
And
so
she got it
good.
for free. So let's, I mean, we don't have it on our docket to cover Demi Moore, but she just was announced as one of the most beautiful people in the world. And I think that's despite her having not a great facelift, which was then redone, and then that upper lip lift that just is not it. But
the pictures they showed of her, and she is absolutely gorgeous, were so airbrushed. I was like, not airbrushed, but like,
yeah.
I was like, this isn't what she looks like though.
And my sister was all about her hair. One of the women she works with also is a hairdresser by trade, like is certified, is like, girl, those are all extensions. Like she has this
Hey, don't hate on
massive
extensions.
I know, I'm not hating on it. It's just that's not a natural hair. Right? So
I don't think anything about her is natural at this point.
And that's fine. Come on, the hair.
She's had so much work.
Great. I just can't get past the upper lip lift because there's really no way to make that better once you've taken out too much. So I have a friend who always says you really should not consider doing an upper lip lift unless you're also doing a corner lip lift. But in her case, I think they just took too much of her upper lip. So it's that skin between your nose and your upper lip. So it's just, whatever. And it looks awkward and when she's moving because her mouth doesn't move the same way.
We need an unfiltered picture, yes, of Demi Moore.
Yeah, who's the person that does that all the time? I'm trying to think of the actress's name. It's always so good.
You know who needs to get on that train is Britney Spears.
Plastic surgery? Or editing her photos? I switched from our Restore SD Instagram account to my Instagram account, and I always forget that I'm following her, and she like jump scares me every time I switch
back.
The
first thing that pops up is her and some wielding knives
in like barely there underwear, looking a mess. All right, so we digress. So let's talk about, she thought he was a licensed surgeon, then her cosmetic surgery left her disfigured. Because I feel like this happens every week, man.
Yeah, except it's in Florida.
This time it's in Florida, which is more par for the course. Last time we discussed a case in New York, and I think that lady did die, actually. But I don't understand these people posing as a doctor. I read this article, and I think he may have been a Venezuelan physician, but then not licensed in the US. So at least he went to some sort of training, unlike our buddy in New York, who I think just picked it up. I don't know. But I just think it's weeks after another doctor from the same facility was apprehended. It looks like New World Medical and Mystic Cosmetic is just a surgical Chop. Chop. I don't know.
Chop.
Say that.
We've said it too many times.
Anyway, like nobody there is actually a physician. So I always say credential where you're going. And that means make sure people are licensed, and it's not that hard to do. You can look them up on, like, for example, in California, you can look up you can go to the California Medical Licensing Board and look people up. You can go to the American Board of Plastic Surgery and verify someone's boarded. Don't believe everything you see on websites and the internet. So you just really have to
say, go look at their website.
Well, if you look at their website and they're saying I'm boarded in this or I'm certified in that, then you just take their actual name and plug it into one of these other databases and check. I don't know. Just terrible. None of these people are practicing with a medical license, which is it's a whole other separate issue beyond, the pediatrician doing liposuction. So you're way outside your lane. These people aren't even necessarily physicians. They're practicing without a license. So nothing to sue here. There's no malpractice. Like, you can't sue somebody for malpractice when they're not actually a physician. So that means
make it like
it's a criminal charge.
Manslaughter?
Yeah. Yeah. It's a criminal charge. But
so is this guy out of a facility or out of like his house?
Out of a facility.
Okay, at least he had that going for him. The crack house in New York where she went to go get her work done. That should have been the first red flag, but
right. I think this is here her breasts were infected, and then he ignored her requests and didn't tell her to go see a legitimate doctor. So again, it just sucks. Again, credential the people that are operating on you. I don't know why you wouldn't. The lead of this article is she thought he was a licensed surgeon, but it doesn't actually tell us how or why she thought it was. So I would like to know how she was misled. But
she probably just read the name New World Medical and
said Dr. Lazaro. Oh, I guess on his Instagram page, Dr. Lazaro, Venezuelan certified plastic surgeon in aesthetics. So
that's crazy.
Great.
We're not in Venezuela.
Right. The topic we've been dying to get to.
Blue Origin.
I can't with the whole let's send some 6 rich bitches to space. Like,
right.
But try and spin that as a STEM calling.
Yeah.
Now astronauts know what it's like to be a doctor and have everybody called a provider, when these girls, women, whatever, are considered astronauts because they zipped up a custom-made suit and went in a capsule. They actually don't have to do anything. When I take a United Airlines flight to Hawaii, am I now a pilot? The hell?
Well, it depends.
I hope not. We all hope I don't become the pilot, because I don't know anything about flying, and these girls don't know anything about being an astronaut. Ugh.
Also, if you look at an actual astronaut when they go to space, they are not wearing skin-tight latex, whatever suits that they were wearing. I mean, I think someone's tits were out. Like, come on.
It was so extra.
Do we have a picture of this?
Yes. Oh, and her daisy. I want to die.
The daisy man. You're going to go spend $1 billion so you can go up and look at Earth for 8 minutes. Why not donate that to something worthwhile? Anything. Yeah,
like assuring reproductive freedom for all women. That would be way more helpful than this influencer trip in the name of #STEM. Oh, yes. Here's the Blue Apron outfits. First of all, no.
Did you say Blue Apron?
Oh, yeah, I did. Never mind. I love Blue Apron.
I wish say one in the same, but don't do Blue Apron dirty like that.
Blue Apron is where we make 3 or 4 meals a week at my house because it's so easy.
That.
Then I don't have to think and grocery shop for specific menu items. I love Blue Apron. I feel like we should have a code to insert here. Okay. Blue Origin, on the other hand.
Blue Apron, please sponsor us.
We busy working moms. And then our kids are like, what's for dinner? Yeah, they look insane with these outfits. Yes. And they have the like zipped
They didn't
up.
even wear helmets or whatever. They just had like hair out.
They were fully glammed. As Katy Perry said, she was going to put the ass in astronaut.
Stop. She did not say
She did
that.
say that. She fully embraced this. I heard a clip of her talking about how she brought the daisy up there. She's like, I brought this daisy from Earth. Girl, where else are you going to get the daisy from? Is there another planet that has daisies I'm unaware of?
It's going right back down to Earth also.
That's right. And it's going to be dead because you just plucked a daisy.
Right.
Only second to her kissing the ground when she got back. Like she was...
You're 8 minutes and have you seen like I saw this one article and it was like their capsule versus an actual capsule that has been to space.
Yeah.
And
So
like
that...
theirs is perfect. And the one that is in space has like burned on the outside because it's actually in space. I'm like, they can't come out and think anyone's going to take them seriously after this.
Well, I think that leads us to our next article, because just when you think this whole thing could die and go away because no one cares, there's like conspiracy theorists that believe that they didn't actually go up to space, that the whole thing was like faked.
You
like
know when you could rent
Argo.
a jet to take pictures and just like
Yes!
rent it for an hour? They probably rented the spaceship or whatever it is.
I can't. Yeah, we should rent a jet just to take photos on our trip to...
Let's do it.
I love space exploration, celebrity culture, and conspiracy. Like it's just like a great combo for creating that. And yes, I guess they said they started to open the door. There's a clip where you're supposed to open the door from the outside. Again, her kissing the ground like she's in, what's that annoying movie? Armageddon? Is that it?
Probably.
You wouldn't know, that my husband watches over and over again. It's like she was just in Armageddon, the Bruce Willis movie where they like launched to space to save the world from a meteor or something. Anyway, yes, this is the all-female crew of Katy Perry's mission. Lauren Sanchez is pissed about that. To space. Her mission to space. Her mission to space. What mission? Appeared to open the door of the capsule from the inside just minutes after landing before hastily shutting it again.
She's and like, letting... oh, shit.
Yeah, and then Jeff Bezos is supposed to come and unlatch it. Like they're like, is it ready? Can we come out? Oh, no, actually, just kidding.
Cameras. And I love how nothing in the area around where the capsule landed is like...
scorched. I think it's on a parachute or something, but I think if I start talking about aerospace engineering, I'm gonna start to look real dumb.
We have to stay in our own lane.
Yeah.
But also they said like Katy Perry's hair, like did you see that one astronaut who was stuck up in space for 9 months and like her hair was like straight up and crazy and Katy Perry's was like
flowing. Yeah.
As she flew by the camera with her daisy.
Yeah, microgravity, and shared her set list. I can't. Okay. I think my head might explode if we...
There's a lot of other things we could have done here. Besides, why is she on the floor?
I don't know. People say that's a fake hand. I mean, God bless these people who have the time to like worry about whether this was a conspiracy or not. Who cares?
Oh, it was dumb. The re-entry burn marks. That is the most pristine space capsule I have ever seen.
I know.
Katie.
Okay, well, let's get on to today's topic, which is... Yeah, real hair in space, fake hair in space. I don't know. Maybe they just didn't make it high enough to get all the gravity away. It's weird. I could talk about the time I worked at NASA, but we already know I'm a giant nerd, but I did spend a summer working at NASA. And there was a room that was all white and sterile, and you could do a fake stunt where you suited up and then like kind of posed in the way that it made you look if you altered the picture like you were in zero gravity. Anyway.
Oh, interesting.
Yeah.
I think they went to NASA for a weekend.
Yeah, just go to space camp, man. Okay, moving on. So let's talk about thigh lifts, because the Daily Mail has the agonizing toll of Ozempic.
What do people expect, though, when they lose a whole bunch of weight at that fast of a rate?
I don't know. I think this happened when bariatric surgery first became popular and caught on. And it still hangs around now where people are like, but I lost 300 or 400 pounds with my gastric bypass. So now you're going to fix me for not free, but via insurance. And insurance is like, absolutely not. That's cosmetic surgery.
Oh,
So
they don't cover any of it?
yeah, insurance will cover usually a breast reduction. And so a lot of these patients don't have enough breast tissue to qualify as a breast reduction. And they'll cover a paniculectomy, which is a lower abdominal skin removal. And that's it. You want an arm lift, a thigh lift, a breast lift, a lower body lift. All of that is considered cosmetic because it's not creating a functional problem, generally speaking. So, yeah, so now we're seeing the same problem. Like if you're losing weight fast, except this is in England where there's socialized medicine. So I'm guessing it is coverable. I don't know. I don't know enough of how they decide whether you get cosmetic surgery or not for free. But people are now trying to fix it because they didn't understand that losing weight, especially losing weight fast, is going to leave you with loose skin. The
Right.
i.e. melted candle body, which I think is crazy. It's like
I can envision it, though.
yes, it's true. Like it's a little wild that like I don't know. It's great.
Yeah.
It's great that they have now an app descriptor for a melted candle body. They shed a quarter of their body weight. They're healthier, but they look worse because they're left with sunken, hollow-looking faces, sagging skin, empty breasts and buttocks.
I just feel
Sorry.
like they want society to be healthier, and you're losing all this weight to be healthy, to ease the burden of our healthcare system. Why not just let them have their loose skin off and let it be covered?
I don't know. Because there's a limited resource for, medical stuff. I don't know. I'm not in
Right.
charge of that. Anyway,
Yeah, we did. We
benefits.
went through a very, very, we were doing a lot of thigh lift, back lifts, abdominoplasties, brachioplasties.
Yeah, we go through it. But now it's summertime. So I think people are like less inclined to do stuff right now for that kind of thing because they're like, well, let me see if I can lose 10 more pounds and I'll catch you in the
Right.
fall. Because then, your whole summer is out because you can't soak in a tub, you can't get in the hot tub, you can't get in the pool, in the ocean until everything's super healed. So it's not a great summer type
Yeah.
operation.
And that's why it's good to be close to your goal weight so that you don't have to go get surgery and then you go lose more weight and then you have to redo surgery because then surgery is
Yes.
just a waste.
Yeah. Don't hit a moving target. So people get all excited when they lose X amount of weight, but you want to make sure you're really at the goal weight that you want to be at before you start tinkering with things. So, New Beauty magazine also reported that thigh lifts were on the rise. Are GLPs like Ozempic behind the growth of thigh lifts? Probably because it's really indicated for people who have extra skin or laxity of the thighs. You can do liposuction, but if that's not the issue, if it's just loose skin, then you really need excision of that skin. You can try other non-invasive things to tighten the skin, but if you have massive weight loss patients, those who have lost 100 pounds or more, then that skin in the inner and outer thigh is hanging. And
Yep.
the only way to do it is to excise it.
So, what are the two ways that you excise the skin?
Okay, so I think when people have the laxity is in the upper third of the thigh, so not all the way down the side of their leg, then I like it's called the apex thigh lift. And so that's an incision that's almost like a bikini cut underwear. So the incision ends up in your gluteal crease and then around the crotch area and then up the groin like to the bikini. And it's great when you do it with an abdominoplasty. You can do it at the same time because that incision will then join the abdominoplasty incision, that low tummy tuck incision, or, you can do it separately as well. It's well hidden. It tends to sag a little bit. So, I wouldn't say your string bikini wearing is gonna be is gonna be inconspicuous. But if you're wearing like a pretty conservative bathing suit afterwards, it should be good. So that's number one. That's probably the more common thigh lift I do because, again, I feel like people in Southern California in general are just smaller. And so a lot of them don't need a huge amount of skin excess removal. If you have excess skin that extends beyond like the upper part of your thigh, meaning that when you look down at your leg, you have excess skin that travels all the way down to your knee or close to it, then that is a more traditional thigh lift. And that is an incision that's on the inseam of your leg. So, like, kind of like the inseam of a pant line from your knee all the way up to your groin crease. And then again, it comes up like an underwear line. And that takes care of skin in that kind of along the whole leg. So you're pulling it around the whole leg, tightening everything together, as opposed to the apex thigh lift where we're just pulling it up a little bit. Pantyhose, I think, is what I'm thinking of. Like when you just pull pantyhose up to get it in your crotch so you're not like feeling like it's hanging low.
I was her
That's it.
yesterday in clinic.
Yeah, I was like, God damn it. My pantyhose would like not stay up. My tights, rather. Anyway, I sound like my grandmother or something.
I said
Pantyhose.
pantyhose on Sunday because I was like, I don't have any pantyhose for dinner. You hit 30 and it's all downhill.
Stockings, I don't know, whatever you want to call it. But when you go to grab that and pull up, that's an apex or medial thigh lift. If you're just going to like do a tapered pant, but on the inside, the incisions on the inside, then that is your full thigh lift. Regular standard thigh lift, that incision is usually a trade-off. So if you just have a little bit of extra skin, you're not like, oh, please, let me just do that whole thigh lift incision, because you're going to see it every time you wear shorts. It's just there. It's hard to hide. You know, we do all the things we normally do to make it heal as nice as possible, but you're still going to have an incision. Now, mind you, it's on the inside of your leg. So if you're standing kind of normally, you're not necessarily going to see it, but it is more visible in shorts. The scar is there. There's no such thing as an invisible scar. There, as you know, certain things we do to try and get the scar to heal as nice as possible. One thing is to not put it on too much tension when you're excising the skin. The second is to close things in layers, so not just relying on the skin to hold the wound together. And then we often put steri strips so that mechanical paper tape adds some healing benefits. You can just continue to tape the incision and that will over time improve the scar, but it's kind of a vintage technique. So a lot of times we will then transition them to a scar cream that has silicone gel in it. And then finally, we laser the scars with a fractionated CO2 laser at 4 to 6 weeks out, and then repeat that 3 times a month apart. And that is our scar protocol. And I think that really does a good job of giving people the best results possible. Occasionally, you can see hypertrophic scarring, and we'll inject that with either Kenalog or 5FU to help the scar soften quicker.
So when you're doing a thigh lift, would you say that like the thigh lift itself, would you recommend doing Renuvion with it or do you lipo? Like what's the best benefit or does the thigh lift itself just really depending on the incision?
I think the thigh lift should be doing the lifting part. I usually use Renuvion for patients that have a little bit of laxity, but not so much that they have skin to excise. So just like your average 40 or 50-year-old woman who has maybe lost and gained the same 10 pounds their whole life and spent some time in the sun, have a little bit of laxity, has a little bit of fat, then Renuvion with liposuction is probably your way to go. I don't do Renuvion with a thigh lift because Renuvion is supposed to be tightening the subcutaneous tissue, and I'm already doing that by excising the skin. I will do liposuction, though, with a thigh lift because I think it can help enhance the results if we need some reshaping, if the patient still has a little bit of localized adiposity, so little pockets of fat, right? So that incision that goes all the way down the inseam of your leg isn't going to address like saddlebags per se. So if you have that little saddlebag area, then you might want to lipo that on the way. And then you know that the medial thigh lift that I do by liposuction, what's going to be excised, because I like to do the avulsion technique of.
Oh, it is so great to watch. Okay, she does this also with brachioplasties, and every single time I make sure our anesthesiologist watches, and every single time he can't watch, and it's so great. Like this is
Yeah,
the prime time.
it's a little gnarly to watch, but it's despite how interesting it is to see, it really is effective. So what we do is
Yeah.
the area that I'm going to excise, I liposuction every last little fat cell out of there so that you just have skin. And then the only thing left behind are nerves, veins, and arteries. And then I make an incision in the skin and essentially pull the skin off because all that's left behind are the
So
nerves,
Dexter of you.
the nerves, the arteries, the lymphatics. So two things, you preserve that so their sensation, etc., is way better afterwards. And number two, no drain required, which patients love.
Woo. We
So
love no drains.
it's called the Hunstead, named after Joe Hunstead. I think he's recently retired, but it's called the avulsion brachioplasty. And then people are like, why aren't we doing this for the thigh? And so we do it for the thigh as well. And it works really well for those cases. Apex thigh lift, as you know, is direct excision because we are really just taking kind of like that banana roll from behind the booty and then that inner thigh laxity that everybody hates and excising that. And that we just straight up excise. And as you can imagine, a little tricky to get in there to close those incisions in the perineal area. So we have to frog leg the patient and it's,
Yeah.
Headlamp and my neck is at some contorted angle for the rest of the
Chiropractor
day.
has to come after that procedure. It's also just so much like she's constantly you guys know how good I am at explaining medical things, so I'm gonna go there's a lot of, like, constantly measuring, and she's reclipping things, and she's making sure everything is pulled up and everything she doesn't take too much, so it's a lot of little tedious work, and you're, like, all up in there.
We ironically call it tailor tacking in the OR. So, but yeah, it's that whole measure twice, cut once. So you want to make sure that you're taking enough, but not too much. And we use different things to kind of pretend hold what we're going to excise out of the way and then mark and then double check and then excise. So,
And then if you're doing the apex one, you have to flip the patient, so you gotta somewhat close it all and then flip the patient over, and it's
yeah, temporarily close. Yes. Yeah. So it is, at least a 4-hour operation, generally speaking, right? And it's a lot of closing if we do the longer incision. I don't combine it with Renuvion. You can combine it with other surgeries, though. What's the one surgery I won't combine it with? What don't I?
Renuvion.
No, yeah, you're right. I said Renuvion, but no. What
Oh,
other?
arms.
Yeah, what other body part?
Yeah, because you need your arms. You want one or the other, and coming from somebody that was it, right?
Mm-hmm.
Okay.
Yes.
I did lipo on my arms and my legs at the same time, and I do not recommend because you're just, like, walking like a stick board. Like, you can't move your legs, you can't move your arms, it's everything is just so uncomfortable. So do one at a time. I know a lot of people are like, "Well, I'm in there, I just wanna get it over with. I only wanna go under anesthesia one time." Mm-mm, don't do it. Don't do
Yeah.
yourself dirty like that.
I will lipo arms and legs, but I tend to provide a note of caution if I'm doing that because we're not excising anything. But I absolutely draw the line at doing a brachioplasty and a thigh lift at the same time. You cannot immobilize all four extremities like that and expect to recover. Like there's just no
Yeah,
way.
I can't
So
imagine.
the two common surgeries, so usually you do arms and breasts together if you have somebody that has a lot of excess skin, so that candle wax body, whatever they were talking about. So you would do arms and breast and then thighs and abdomen. If you know you're going to do all four body parts at some point, that's how I would break it down. But a lot of people, and so I tell patients, that's like a logical pairing, but you have limited funds. So if you want to tackle the most important thing to you, then pick that. So for women, it's either the abdomen or the breasts. And so I get it. You want to do breasts and abdomen together, which is totally reasonable. But then now you're going to have two more surgeries, arms later and then legs later, which is fair. You can do that. But if you want to do breast and abdomen, because you don't think you're going to come back for either thighs or arms, then do that. So it's a little bit of, it's a conversation. You have to balance like what bothers you the most and you want to get done first and what the overall plan is to get rid of all the extra skin. Because arms and thighs together is a no-go. Just not
Don't do
possible.
it. And how long do you think the recovery is on the thigh lift?
I tell people a solid 4 to 6 weeks. So thighs are brutal because they're always under the heart. Like, unless you're standing on your head for an hour a day, like, I don't know how you're going to get that swelling down. So I tell people to lay down and put their legs up. So in yoga, that's called legs up against the wall or legs up the wall. That helps, but you're only doing that for what, 10 or 15 minutes, a couple times a day. The rest of the time, your thighs are below your heart and they're prone to swelling. So you're in a compression garment. Those incisions take a long time to heal. So 2 weeks of taking it easy, and then a solid 4 to 6 weeks before you can exercise again, because you don't want to pull those incisions apart.
Don't go squatting.
Or skiing.
Yes.
We've had that. And then even when patients are super careful, this is just, I think people underestimate, like, you need your legs, and it sucks when, I mean, if you've ever had like a broken foot or an ACL tear or something like that, then you know how hobbling it is to be in a cast or a boot or in one of those scooter things. But not everybody's had that experience before. So they kind of underestimate how unstable you are on your legs. So I've had a patient that got up in the middle of the night a couple weeks after thigh lift and fell because she was trying to let her dog out to pee at like midnight. Her thigh lift remained intact, but she broke her ankle, which sucked. And then we've had another patient that was home by herself, and she got up to do something and caught her foot on the corner of her rug and went down. And remember, and she tore her incision open on her thigh, which I was like, well, how bad? Like, I mean, what do you mean? And she's like, no, it's bad. And essentially her whole incision down the middle of her thigh came apart. So that was returned to the OR to put that back together. And she wasn't doing anything. She wasn't, you know what I mean? She literally was trying to stay cool home in her house and tripped on something. So that can happen too, even if you're doing your best. But then we have those that are like, well, I'm going to go scuba diving. And you're like, please don't.
No.
Or skiing. No, don't. Everyone thinks they're so invincible, and then they have surgery and they're like, oh, actually,
this sucks.
Just kidding.
I feel like people plan, I feel like especially for lipo, everyone thinks that it's going to be like an easy procedure. They plan things after, and then they come in like post-op day 1 and they're like, oh my God, I did not expect it to be this hard. I feel like I got hit by a bus. And you're like, yeah,
we
can't go on that trip 3 days later, you know?
Yeah, unless you're Jordan.
Yeah, she's crazy, but take time to recover.
I would say it's a bell curve, and there's going to be 5% of the people that are like, oh my God, I can't get out of bed after something, name the surgery, but liposuction is a good example. Most people are like, oh, that took me a minute. And then another 5% that like it doesn't slow them down. But the majority of people, you're going to be like, oh, I'm really sore. That took a lot out of me, more than I imagined. And everyone thinks they're going to be in the 5% that isn't slow, like doesn't get slowed down. And when you are not in that 5%, you're like, oh, it's going to take me 2 weeks to recover. Yes, that's kind of what we told you. So yeah, I mean, it really matters, that recovery time. Even if you feel good, you need to take it easy, because you just can't predict how things are going to go. And I see it all the time. Patients sometimes, once everything's said and done and they're healed, they're like, yeah, I didn't want to tell you, but 3 days after my labiaplasty, I went and did X, Y, and Z. And I'm like,
I know. We had one the other day who I saw, and she was like, oh yeah, well, it's okay. I started working out after like 5 days. And I was like, girl, you weren't supposed to.
I know.
But they don't say it till after the fact, but it's like,
if they get away with it.
Yeah. And then she's like, well, I was swollen a little bit longer. And I was like,
yeah,
don't know what you expect.
Yeah. All right. So let's see. What else can we talk about for thigh lift besides taking the time to recover? So I would say this is one of those surgeries. If you're in a job where you stand all day, you're a scrub tech, you're a nurse, doctor, work in some sort of retail, you need to give yourself at least 4 to 6 weeks off, because you're just not going to be able to do it. So make sure you're planning for the recovery. And then I think if you're trying to do it without the excisional surgery, that's when Renuvion comes in, but it only works to a certain extent. So it's really for those either borderline patients or patients who have minimal laxity and just want an improvement. And will insurance ever cover thigh lift? Not really. There's no functional issue here. You're not going to have skin that leaves you with a rash. They're just not interested in covering that. That's the thigh lift in 45 minutes or less.
Will a thigh lift get rid of cellulite?
No. Cellulite is the devil.
Unless you have Avali.
Yeah, Avali helps. Yeah, cellulite on the thigh, you're not actually addressing the cellulite if you're pulling the skin up. It can maybe improve laxity, like any textural changes related with laxity, but cellulite is the tethering of your skin to underlying subcutaneous tissue. And if you don't cut those little fibrous septae, you're not solving the cellulite problem. Liposuction tends to make it worse sometimes.
Would you ever combine doing Avali with a thigh lift, or would that just not work?
I would do Avali to the buttocks cellulite, but I wouldn't mess with the thigh cellulite while I was doing a thigh lift. But you do know I'll do Avali at the same time as liposuction or Renuvion to the thigh. That combo is great. Yeah. Everything's working. And I was just talking yesterday with someone, I will also add Radiesse, which is a biostimulator, to a cellulite treatment like Avali to kind of fill out any dips and also stimulate collagen, which you need more of, because a lot of people don't present with just cellulite. They have cellulite and if you're in the Ozempic world, it's usually and laxity. So you have some sagging of the skin, little stretch marks, and you can fix the cellulite, but it's not going to give you that smooth airbrush look. It'll just improve the dimpling. And so if you can help stimulate collagen and kind of smooth it out with a biostimulating filler like Radiesse or Sculptra or your own fat, that's all win-win. We've seen some nice results with the Radiesse.
Really good. Really good.
And Bree is on the chopping block for fixing her hip dip from a previous BBL. With Radiesse. Yes.
I actually didn't even notice it until I went in the bathroom and I was showing her something. So I
feel
took
like
my pants off.
I feel like you were
showing you my butt.
I feel like
you were like, oh, did you want to fix that dimple? And I was like, you bitch. Now all I can see is the little dip.
Yeah, I don't normally point things out to people unless they're asking. I feel like you were auditioning for Avali. Like you're like, look at my cellulite. And I was like, you don't have any cellulite, but you do have that one dip. And I've been promising to put Radiesse in it forever, but we will do it.
For a long time.
As soon as you get back from Alaska, we will do it. I promise. Promise.
Put on the back burner. She makes me work instead.
I know. You've definitely been working a lot.
There's a question on here that says, what happens during a thigh lift? Tears. Lots of tears. Okay, I'm done.
Physical exhaustion. So if you have questions about thigh lift or body contouring surgery in general, especially after weight loss, please reach out to us, like and subscribe. We'll be back with another episode.
Slay.
Not slay. Why don't you show Hannah what was it?
We're scrubbing in.
And scrubbing out. Bye. If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at RestoreSD Plastic Surgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.